Morning, everyone, and welcome here to the great campus of Brookdale Community College, our true partner here through many endeavors that we have here. And Brookdale's always been somebody that we constantly count on here, and that shows even more now during this vaccine process. I want to thank everybody that has assisted us through this process here. And we've spoken through the periods of time since March 9th, and all the things that we've moved forward through. And now we're getting to the part of we're engulfed into the vaccination. Chris and Gerald from our health department, I want to thank both of you because obviously you're on the forefront there and you're doing a fabulous job. Terry O'Connor, I want to thank you and your staff. You're doing a terrific job. I know it's endless hours there. Trish, getting the message out, and anybody else that I'm missing here, please feel free. It's hard to recognize people when they're out there with those masks, big arena here. I have some guests in front of me. Obviously, I'll start here with Commissioner Pitcha, Committeeman Yvonne Clayton, Mayor John Moore, Pastor Van Zandt, Deputy Director Sue Kylie. And today is an exciting day. Listen, it has been difficult with these vaccinations. It's been difficult because of the process, okay? Myself, Sue, Ross, Nick, and Lillian, the one thing that we like about Monmouth County, enjoy about Monmouth County, is we control Monmouth County. But in this process, we have not had the full control because of the distribution of the vaccinations. But it's changing. We see it changing, especially with the new distribution of the Johnson & Johnson vaccination. So we know that some areas are much more difficult. We're sitting here at Brookdale Community College. We put out roughly 2,000 vaccinations a week here. We have our agriculture building there in Freehold. We roughly have about 500 vaccinations going there, but we know that's not enough. We need to get to the communities that need it, and that's our partnerships. As we all know, that we just had our partnership of, I guess it was about a month ago, with Pastor Porter and in Red Bank, where we basically started in the area there where we could reach that community and reach the community that might not be able to make it to Brookdale, might not be able to make it to the agriculture building. Well, today we're announcing another partnership, and we're very, very happy to announce partnership between the Second Baptist Church of Asbury Park to bring directly vaccines to the residents there, along with Mayor Moore and the committee. And I'll let Mayor Moore talk about how the process went there, but this is a true partnership. Monmouth County governs in a much different way than most counties. We work with 53 towns. It does not matter what party you are, Republican, Democrat, Independent. We are partners through this process, and we'll end partners at the end of this process. So it's an honor for myself to introduce Mayor Moore, because the one thing you can count on when you contact Mayor Moore is results, along with his committee. And he has the great partners like I have with them. He has it in his community. I'm going to call up Mayor Moore.
Thank you very much. Let me get my thank yous out of the way, and then I'll give a couple minutes of what happened. So I want to thank all the commissioners, especially Director Arnone and Deputy Director Kylie, who's the liaison for the Department of Health. County Administrator Terry O'Connor, Mr. Christopher Merkel, and Gerald Crowdle. These people have been fantastic. The City of Asbury Park, as usual, as far as trying to get site in Asbury Park and vaccinations in Asbury Park for elderly and the people that really need it. This started approximately 5 weeks ago today, where I called the director and said, sit down because I'm going to ask you a crazy question, and I have this crazy idea. What are the odds or chances of getting a site in Asbury Park where we can get vaccinations right to our people that need it the most? His response kind of floored me, where he said, John, it's not that crazy. Truthfully, we're looking to do this in Red Bank shortly, and we would love for Asbury Park to be next. So with the delays in not getting enough vaccines and the terrible weather where Memphis and Louisville were shut down, so all the vaccines were basically halted. We got to this point within the last week. We've made up for the 5 weeks, and it's been full speed ahead. And when I talked to the director, he said, John, no problem coming to Asbury Park, but you have to have somebody that can help you. And without hesitation, without asking, I said, I've got somebody. Got Dr. Van Sant, Pastor Van Sant, the Second Baptist Church, who would be a perfect fit for Asbury Park in the county. So again, Yvonne Clayton, the councilwoman, is here today. The entire council wanted to be here today. Some had to work, some didn't. But we can never thank the Board of Commissioners so much for what they're doing for Asbury Park. And again, I thank you also very much. I'll let Pastor Van Sant go next. Thank you.
Good morning, and I want to say thank you to Tom Manone, Commissioner Director, and the other commissioners and the team that has helped to make this possible. One of the best mayors of any city, in my biased and unbiased opinion, John Moore, and of course Councilwoman Clayton, and all others who have helped to make this possible. I am extremely grateful, and I stand here as representative of the west side of Asbury Park, and also just a concerned citizen and stakeholder. And I am just so grateful because what this outlines for us is that always is the struggle for equity and equality to make sure that all of the citizens are able to have equal access and to all resources. And this partnership signifies a step or another part and way in which we come together as people, as the ones who occupy this wonderful space we call Monmouth County, and we are together, right, and working to make sure that all of everyone knows that they matter, and we show it in our actions, not just our words, by having this pop-up clinic sorts at Second Baptist Church. And I just stand here also on behalf of all of the leaders and the membership of Second Baptist Church who welcome this venture, welcome this project, welcome this opportunity really to serve the community in such a significant way. And I am just so grateful and pray that this continues to grow and that it continues to flourish and that it is continues to be an example of what we can do when we all work together, even when we got the big government saying, reducing supply. But I'm so grateful for this and knowing that you all are doing everything that you can. And so just want to say thank you. And I look forward to seeing the positive results so that we can all get out of these masks. Thanks.
Thank you. And I guess people don't realize how special it feels to myself and the commission, the rest of our staff here, when we know that we're out there in the public doing what we are served to do. This is our job to do this, to get out in the community. Not all the things that we do are easy. Sometimes you got to be a little creative and think out of the box. So I want to thank Mayor Moore, Pastor Van Sant, Yvonne. Please pass on to the rest of the committee there in Asbury Park. So I'm also excited to announce today that we are going to be launching a vaccine scheduling system here for Monmouth County residents who are currently eligible for the vaccine to log on and make appointments themselves. Residents will be able to make appointments for a vaccine here at Brookdale Community College 4 days per week, from Tuesday through Thursday and on Saturday. Appointments will be open to Monmouth County residents who are currently eligible according to state guidelines. Appointments will be open for the upcoming week once we receive confirmation of the amount of vaccines we are receiving. There will be a number of appointments reserved here and at the Monmouth County Agriculture Building for those who are currently on the waiting list. There will also be appointments reserved at the Monmouth County Agriculture Building for seniors who do not have access to technology. The appointments for those seniors are being coordinated with our Office on Aging. We have a representative, Susan, you're here. Sue, you're here today. I think that's you behind that mask there. Maybe not. And but with the scheduling system, we'll launch Monday at 8 a.m. on visitmonmouth.com/health. Information about who is currently eligible is also available on our website. We understand that these appointments will move quickly, as we are still only receiving a small amount of vaccines through the state. But we promise we will continue to advocate for more vaccines for Monmouth County. You know, before I pass this on to the deputy director that's been by my side through this whole process here and has worked extremely, extremely difficult trying to coordinate the health side, and it's been a great help to myself to be able to have her do this. You know, I think it's time that the state looks down and says Monmouth County does it right. Monmouth County is getting the vaccines out. Continue to give us that opportunity to succeed. The only way we're going to succeed is if you give us those dosages and those vaccines. I'm gonna pop back on after Sue gives a really good report on where we are in certain areas on another topic that I think is very important to all of us here. Deputy Director Sue Kylie.
Thank you, Director. Appreciate that. So let me give you an update on where we stand with vaccination sites and the vaccines. We're doing a phenomenal job in giving out the vaccines that we have. Please keep in mind, there are two things we have no control over: when we get the vaccines and how many we get. We have capacity at Brookdale, and we have capacity at the Agriculture Building to take on more. So we're really working with the state to ask for more vaccines so we can vaccinate more people. But today, we have vaccinated 24,553. 17,917 of those are first doses of Moderna, and 6,623 of those are second doses of Moderna. We also have good news to report on the numbers as it relates to COVID cases. Our cases are trending down. That sounds so good. Our hospital stays are tracking down, and ventilator use is trending down. So that's all really good news. As far as testing is concerned, to date, Monmouth County has administered 9,788 tests, with only 770 of those people being positive. That testing is free, and it started in July. It is not necessary to have symptoms. You can just come in, request the test, and you can get it. So I encourage people to continue to do that, because that contributes to us fighting this pandemic. We're also working on a plan because, as you know, now the teachers are going to start receiving vaccinations as of March 15th. That group of people is educators, their support staff, child care workers, public and local transportation workers, transit workers. So it's a very large group of people, which is going to add a very large demand for vaccines. We're working closely with the superintendent of schools, who is going to help coordinate a schedule so that we can have a seamless operation for teachers. And the new registration system that Monmouth County put together is going to help that tremendously. Just please remember that there's a couple of questions people ask, and one is, how do I get a vaccine? You have to register, and there is no such thing as a centralized registration system. So if you want to get your vaccine through Monmouth County, you need to go, as the director said, to the Monmouth County Visit Monmouth website and register there. And that will get you into the registration for Brookdale Community College or the Agriculture. All the other sites that are out there have their own registration sites. So please make sure, if you're looking to register at multiple ones, that you do so correctly. The vaccine that is being given here at Brookdale and at the Ag Building is the Moderna vaccine. Pfizer is also being administered at other facilities, and J&J's vaccine is coming as well. But it's important to know that if your first shot was from Moderna, you have to have the second shot from Moderna. As far as moving forward, it's still critically important for us to wear a face mask, to socially distance, to make sure that we wash our hands often. And greater days are surely ahead. Thank you very much.
Thank you, Sue. Great update. So as you can see, Sue and I, we have our positions, along with our remaining freeholders, and Ross coming on board this year has dived right into it, along with Nick and Lillian there. Both of them could not make it today. So I'm going to divert a second here from what this subject is about, because it's something very personal to myself and the commissioners, and I see the sheriff back there, and to Sheriff Golden back there, and that is the legislation that was just passed and signed, I should say. Sue? Sheriff, would you come up here with us? I think it's important that we're a united group on this. So, as we all know, the marijuana bill was passed and voted on, and that's fine, 100% fine. The people spoke, and that's what they voted for, and that's not why we're here, standing here today. This is not a Republican Democrat thing. This is a right and wrong thing. This is a parent thing here, because I do truly believe, and I sent that message out, that all the individuals that voted on this legislation and voted on this bill did not know this one component. And this component was the way the free pass our young adults, our children, were going to get. As a parent, all of us standing up here as parents, the one thing we want to know at their early age is if they're doing right or wrong. And we count on the people that we can count on to let us know. I have never asked either one of my colleagues here or the sheriff, when I was that age at 13 years old, the last thing I wanted to go was back to my father's house. I'd rather go to the police station than go back there. And I think that is the same thing now, because there was a sign of right and wrong that it was instilled in you. But more importantly, what people do not know is that we are allowing individuals, children, to be able to go under the influence, whether it's alcohol, marijuana, and be told that's wrong, take it, confiscate it from them, I would imagine, okay? And then be able to move on to another location. Correct me if I'm wrong, Sheriff. If they are in a municipality and this occurs and that warning is given, it's not in the state system, so a child could go to the neighboring town and do the same thing over. It's mind-boggling to me that a legislator, any legislator, could sit up there and think this is right. We need 21 county commissioners, boards, to come out, Republican or Democrat, and say, revise this legislation. We're not talking about what was voted on. We're talking about right and wrong and the parents' ability to make sure their children are growing up doing the right thing. So what I asked the media, support us on this. Know that this is the right thing, and everybody knows it's the right thing. And we just are mind-boggled to understand how people could even think about this or discuss this in a room together. So we're pleading with our legislators, go back to the table, go back to Trenton, and remove this component on that legislation. Sure. So I don't want to speak for Pastor Van Zandt or Mayor Moore when I say this, but I think in our early discussions, we talked about a good allocation going to your parish and staying there, and in this community, Asbury Park. As you know, we're in Red Bank right now, and our goal here is to, and I've been in discussions with another municipality close in proximity to them that I've been speaking with our Administrator Terry O'Connor on, hopefully unveiling. But what we need is vaccinations. We're limited with the vaccinations here, and that's the biggest component here. We're willing to distribute vaccinations led by Chris and Gerald. I mean, people don't know the staff that we have. We have volunteers. We're bringing in what they need. They're telling us what they need, and we're making sure we provide them staff to get it out to more communities. Suzanne, you're absolutely right. We need to be in these communities, and that's why we're putting it out there, okay? And we're putting it in Pastor Van Zandt's hands there to administer it to what he feels is right. I would have to leave that up to Pastor Van Zandt once he puts it together. Maybe you could contact him afterwards once he structures it, because that's our whole process, is to put it in their hands, because you know your community. You know what you need and what the needs are. So I think, correct me if I'm wrong, you asked if I was going to, or we were going to receive any more allocations, and the Johnson & Johnson? Okay, so we did receive 800 vaccinations this past week, and we're distributing them out. We're limited on where we can distribute those vaccinations there, and that's a state regulation. That's not a Monmouth County regulation. So let me be clear about that. That's a state regulation on where we could distribute those. So, we're given the 2,500. There's no question in my mind if they increase that allocation, we will be able to provide that allocation. But right now, we just received 800. We have no idea until Monday morning what we're going to receive in the Moderna and what we're going to receive with the Johnson & Johnson. So I have to believe they put it in place probably in the 23rd hour. So I think they can take it out in the 23rd hour. It's that one component needs to be removed. I mean, we are handcuffing our police officers, our law enforcement, our parents, and we're hurting our children. There's no explanation to it. No, I think they heard my voice. They heard our voice. They know where Monmouth County stands. And as of today, we're asking the other 20 counties to join us on this. At the end of the day, look at the items we're talking about here. Okay, just listen to the items we're talking about. Look at what you're talking about here. And I will tell you, if you have any question on the salaries of the freeholders, just go to our W-2s. But think about the importance of our questions. And maybe that's some of the problems that the Trenton's doing now. Okay? I want to thank everybody. Have a great day, and I want to thank you for being here.